Very good evening to everybody. And first of all, at the onset, my heartiest gratitudes to Dr. Rajsekar sir for inviting me and to the organizing committee of ACC 2025. So my topic is about CT assessment in TAVI and choosing the right valve. And what we all understand today is that why we do TAVI. We do TAVIs today to reduce adverse outcomes, to make our patients go home without any serious comorbidities and make them again active in their lives. Because TAVI we don't do just for high-risk cases, now we are doing for even low-risk patients whom maybe 10 years back you would be doing an open heart surgery instead of TAVI. So for that purpose, imaging is very important, so is valve and the interventional team. But if we want to have a simple and safe TAVI, we need an imaging that should be crystal clear, and this is what decides the outcomes in all respect. So key aspects that we should look into when we are planning a TAVI is, first of all, the aortic annulus sizing. This is important because it gives the actual aortic annulus where our valve is going to sit in, and this is how you decide your valve, the size of the valve. Then you need the aortic root anatomy as well as the coronary ostia. It identifies our aortic root dimensions, sinus of Valsalva, what is the STJ heights, what is the coronary height. And this is important because you want to minimize the risk. And most important risk that is lying in the coronary sinus is the coronary arteries. And you have to be sure that your valve is not going to block those things. And also it determines the safety of the procedure because the distribution of calcification and the angulation determines the success of the procedure. I'm so sorry for my phone. So these two aspects are to start with, the annulus sizing as well as the aortic root anatomy and the coronary ostia. And we all know today that aortic annulus is not a single plane structure. It's a 3D structure, and for that you need a 3D evaluation that the CT test can provide, because there is no clear-cut annulus. How do we determine the annulus in TAVI case? We determine by choosing the lowest most points of the sinuses, the LCC, NCC, and the RCC. And these are the these are the dimensions we need. We need the aortic annulus, we need the STJ height and the sinus of Valsalva diameter, we need the ascending aorta dimensions, we need the alveoli, we need the coronary ostia, and these things determine what valve, what size, and what complications or challenges to expect. So coming to valve morphology, as I was saying, that one thing that needs to be looked into, what is our valve? It's a tricuspid valve or a bicuspid valve. And definitely, as I said, that annular calcification, this is very important determinant, not to the outcome about where you are going to have a PVL, as well as the safety of the procedure, and leaflet thickness and any other abnormalities. And this is more important in cases where bicuspid aortic valves, which are very common in our societies, our geography, that we see more and more patients having bicuspids than tricuspids. The leaflets can be lengthy, and even the coronary height, which may look like adequate, may not be sufficient enough. And obviously peripheral vascular assistant, because that gives us the real access to the valve, because we need to know the aorta, we need to know the iliac arteries, the femorals, as well as the alternate structures. So this is all that is initially included in the analysis of CT for TAVI. And for that, we need a crystal clear image. So don't shy away from getting a CT that is good. So my belief is that if you prepare a patient properly, you can use a recommended dose of contrast in most of the patients. And it's important that breath holding should be there. It should be ECG-gated. And the reason that it should be ECG-gated is that you need to determine the dimensions in the systole. And if by any chance we are not able to do a CT angiography, CT autogram in such patients, you can alternatively rely on a 3D transesophageal echo. But yes, there are chances that you can underestimate the dimensions, and you have to factor in those things when you're deciding about the valve size.